अस्सलाम वालेकुम, मेरा नाम अहमद जलाल है. आई एम फाउंडर CEO ऑफ कोडोबा वेंचर्स और जम्बील पार्टनर्स. कोविड-19 की वजह से वी आर ऑल इन आवर हाउसेस एंड थ्रू दैट हमारे उसकी वजह से वी आर ब्रॉडकास्टिंग अक्रॉस कराची एंड द होल ऑफ पाकिस्तान. So the topic we're going to talk about is COVID-19 because it is of so immense importance और जिसने हमारी सारी ज़िंदगियाँ चेंज कर दी. किस तरह हम इसको डील कर सकते हैं. But one of the other things that I realized was that कि cholera outbreak हुआ था and Isaac Newton, one of the greatest physicists, was barricaded and was quarantined inside his house. And in that period of self-reflection and read between his books and his house, he was able to come up with calculus and he was able to come up with the theory of gravity. So hopefully you and I can spend some valuable time in our homes, in solitude, in learning, and come up with innovative ideas for the new world that's going to happen in the after COVID-19 outbreak. So COVID-19 is a serious challenge that we face, both economic, health and society. And it seems that there is a choice we have to make for economy or for health. And these are not easy choices that we see our policymakers struggle with. So I have thought about how to deal with this problem, and in that way I got inspiration from something that is from our common history. Something had happened in the past, long time ago, in fact 627 AD, where Muslims of Medina, so Yathrib, were faced an overwhelming enemy. Where there were 10,000 of allies who were coming in order to defeat the Muslims in Medina, and Hazur sallallahu alaihi wasallam got advice and counsel from the Sahaba Karam. And one of the Sahaba, Hazrat Salman Farsi, approached this idea and he said, instead of fighting the enemy out in the open or within the city in a close combat, why not create a trench or a KHANDAQ and then fight them and isolate ourselves from the enemy, and to isolate ourselves, to delay the enemy and to defer it, and to be able to win it in that manner through protecting yourself. Of course, this was a strategy. The KHANDAQ strategy was employed in ancient Persia for a long time, but that was taken. Hazur sallallahu alaihi wasallam took that advice, and as you can see, this is from an ancient map, and this is now modern, where the KHANDAQ was dug out. The Muslims, in a very short period of time, dug a KHANDAQ, a kind of a barricade in this area. And this was, so the other areas were protected, and this area was dug. So the enemy came, but they were not able to cross it. And so over 27 days, this stalemate lasted, and through delaying it, they were able to frustrate the enemy. The enemy came to the gates of Medina but was not able to penetrate and was able to come back. Inside of it, the Muslims were prepared, so there was an early harvest. They were able to take hardships, much severe hardships of those days, including famine, in order to be able to take that. And so here we are facing a similar kind of situation, whereby we have an overwhelming enemy. And so is there something in our past that we can leverage from? For example, the KHANDAQ strategy to deploy in our current situation, because we face a very grave challenge. And so this is something that I came up with. This is something I came up with, barricaded in the house in isolation. Then maybe there is a strategy. I call it the KHANDAQ COVID-19 isolation strategy that we can deploy. And what we do is, just like the Muslims of Medina creates an isolation zone around Medina, we need to find isolation units which are across the city, across the country. And so what can they be isolation units? The number one is a unit like a factory or a company which is a bit self-sustaining, where there is some kind of isolation you can undertake. And the company, so that is one isolation unit, and with an employee base. And then the second isolation unit is about your home, because of course, if you're protected here, then you need to be protected there. And so the other isolation unit has to be around home or community. And these are both very important. We are both motivated, everyone motivated to protect these, because here it depends on our livelihoods, whereas over here it is about the people that we love. So we want to protect all of those. So this is we create an imaginary, in a way, KHANDAQ around it, an isolation unit, and those companies, those communities that undertake to volunteer to screen about 50% of their employees. So if 50% of those who are screened, they don't have COVID, they can continue to work, whereas those who are not, they are sent home or they are sent into isolation units, but the rest of the organization can continue to work. And so, but the company has to undertake the responsibility of also providing the testing to the households, so that the employee is safe over here and he has a safe environment over here. So you have now created 2 testing zones, and one at a home and also one at the employee. So that's, but then how do you protect, how do you create a safe passage between the two? So in that safe passage, then you have companies like Airlift, Swivel, Kareem, who also have in that case tested their own employees, and so that their own employees who are clear of COVID are able to drive those vehicles, can transport people from one place to another. So you can see that there are pockets, and there are pockets of these isolation units around the city, and then the safe passages that is provided by those companies to do that. And if we do it in a very coordinated, it has to be centrally coordinated and managed, so that companies can volunteer who put up for it, who volunteer for doing the testing. And if they do the testing, the good thing is that they can continue to operate, which is a big potential benefit to them versus a shutdown. And then, so it has to be centrally coordinated, and if you are coordinated well, you will have concentric circles of these isolation units across the city, and the more they overlap, the more reinforcing and the more protective they become. And then you need to make sure that there is safety and there is containment. That's the 4th pillar of it. So even though you have tested it, you give employees a degrees of hand sanitizers, the N95 mask, the safety kits. You provide them on a bi-weekly basis, so they remain safe from COVID over a period of time. And these have to be monitored, these have to be followed up with the proper SOPs, so that a company, so that the employees, so these safety units or these isolation zones, protective zones can remain protected. All of this has a cost. But if you consider it, the cost of testing for both employees, a 500 employee company, testing 50% of it, with 200,500 in a household, again testing to 50% of it, is a total cost of about 6.8 million rupees. This is both a testing, but also of the maintenance of first bi-weekly supply of safety kit. So this is 6.8 million for an employee organization of 500 employees, but in return of that, we are able to get those companies working and get them back and kickstart the economy. So if you consider Karachi's cost of shutdown per day is about 12 billion rupees, whereas the cost of executing this strategy is about 49 billion rupees, or about only 4 lost days of work. So this has a huge benefit in terms of kickstarting the economy. So the jobs are protected, so Pakistan's economy is protected, but also making sure people who suffer from COVID are taken care of separately, the healthcare system operates. We don't have to make a choice. But this requires 2 things. This requires strong governance, number 1, in the form of either the centrally from the Prime Minister's office and the NDMA, or the provincial Chief Minister's office and the PDMAs to coordinate it, and a central nervous system of technology, which is the National IT Board or the provincial IT board or the health departments acting, because a lot of it is gonna be a bit data generating and things like that. One of the things we can do in safety is also the tracer apps, जो कि सिंगापुर में बहुत successful हैं. Once you have these people secured, you give them tracer app so that they can be monitored for at-risk. And the last bit that is needed is the operational requirements. You need to make it open for companies to import COVID-19 kits. America में हो रहा है, states कर रही हैं, country कर रही है, everyone is doing it. Why not in Pakistan? Number two, you have to do is to get the doctors and house job people and nurses and community health workers to be trained on testing, because you need to train, you need to test lockdown for about initially 3 to 5 days for you to then carry out this process. And that period you need a lot of people to test it. So those are the operational requirements, and then you have law enforcement agencies you need for that lockdown period. So these are the different things that you need, both governance wise and operationally. And there's a clear step-by-step KHANDAQ creating an isolation unit, creating a safe passage, then a central command and control system for driving it, and then safety and containment mechanism. If we do that, we are able to maintain the spread of the disease and kickstart the economy. It doesn't have to be a choice. This thing can continue for 18 months. So we need to prepare something for the long run. Our lockdown cannot continue beyond a certain period. We need to get back working. The economy needs to start flowing. And this strategy, the COVID KHANDAQ strategy, offers one viable way, an implementation pathway to achieving that.